Good morning, everyone. Thank you for the nice introduction. First of all, my sincere thanks to the Rotary Club Salem for giving me this opportunity to interact and introduce myself to the esteemed members of the Rotary Club Salem. I recently visited your Facebook page, and I see that you guys are quite active in the community. Please accept my sincere appreciation for what you are doing in this community. So without much delay, I will go on to the today's topic. The today's topic will be like spine care while you are young. The reason why I have mentioned while you are young is because, first of all, it should be pertinent to the Rotaract Club members. I understand that most of the members age group is between 18 to 30. Correct me if I'm wrong. But it doesn't necessarily mean that whatever we are going to discuss or I'm going to discuss in this presentation should be followed only by the young people. It is relevant to the elder generation. The younger you start carrying your spine, you can spend your older age with less symptoms. Okay, so already thanks for the person who has given me a nice introduction about myself. So in this talk, we will be discussing over the common spinal complaints in younger people and what are the possible causes and what are the things that we should do and we should avoid in having a healthy spine, and some of the frequently asked questions by the patients in my clinic will also be discussed. So the common complaints that I come across among the younger people in the clinic is like they say I have neck pain and low back pain. Sometimes they say this neck pain spreads to the to the skull, or it spreads to the mid back. Similarly, the back pain spreads to the mid back and to the gluteal region as well. And most of it, most of the times, it is the pain occurs when they sit for longer duration, maybe in front of computer, maybe while working, and gets relieved after lying down or after taking a period of rest or after going a period of walk. So we call these symptoms as mechanical symptoms. I will discussing more about in the later slides. So the other question is the people ask me, patients ask me is, I'm doctor, I'm only 35 years old or 30 years old. Why am I getting this symptom? I feel like I'm a 50-year-old. Why me? And before we go into the reason or the causes for these symptoms, I think we should first understand a little bit about anatomy, about the structure of our spine. I will try to keep it very simple. Our spine is a very complicated structure which has made up of multiple bones which are beautifully arranged with which are interconnected with ligaments, discs and joints. Okay. And in addition to the bones, there are structures like disc, which acts like a shock absorber, and ligaments. தமிழ்ல வந்து நம்ம தசை நாறுகள்னு சொல்லுவாங்கல்ல. So ligaments which connect between the two bones, and also the spine is supported by a large group of many number of muscles. Some are small, some are big, which are very important in maintaining a proper spinal balance. Some of these muscles, they span almost the whole of the spine. That's why, like sometimes we feel that the pain in the neck also spreads to the shoulder and spreads to the mid back. So that is the reason, because these muscles they spread over over a large region. And apart from the muscles which are directly attached to the spine, there are another set of muscles called core muscles, which are mainly the muscles of your abdomen and muscles of the buttock region, which are again very important in maintaining the stability of the spine. And most importantly, the spine protects the spinal cord. There is a hole inside the, there is a canal inside the spine, which I'm not sure whether you can see the specimen. The spinal cord travels from the brain all the way down, and we can see the nerves. You can see the nerves coming out of the holes in the spine. So, so any major problem or major issues in the spine can also affect cause compression on the nerves and can relate to nerve related symptoms as well, or spinal cord related symptoms. And we should also understand that our spine is not a straight structure. It has got inherent curvatures, and why I will discuss more later. Why is it important that we pay attention in maintaining these curvatures during the activities that we do on day-to-day basis. So this is the anatomy in short, in brief. Now coming to the understanding about pain source, what causes the pain? So, as we have seen, the spine has got many structures, right? Muscles, ligaments, joints, and disc, and any of these can be the source of the pain. And in most of the cases with which patients present to us, we call this condition or the source of the pain to be from degenerative or wear and tear changes. They arise from the degeneration of the structures which are happening in these structures, or it could be due to the wear and tear changes. So what do you mean by the wear and tear changes? இப்போ வந்து நம்ம காரில் டயர்ஸ் இருக்கு. ஸோ த மோர் வி ரன் தி கார், த மோர் இட் கார் டயர் வந்து சீக்கிரம் தேயும்ல. ஸோ அதே மாதிரி the more we improperly use the spine, it's likely that the degeneration happens faster. For example, like if you're not taking care of the car, for example, proper wheel alignment panla or wheel balancing panla in the sense, so one of the tire or one side of the tire, there is a high chance that it will wear out faster. So similarly, like improper care given to our spine can cause accelerated சீக்கிரமா தேயறதுக்கான வாய்ப்பு அதிகமாகுது. Of course, like there are other serious concerns which always require a spine surgeon attention. Like நீங்க ஒரு spine surgeon கண்டிப்பா பார்க்கணும் இந்த மாதிரி ஒரு conditionsல. For example, when there is a fracture, when there is infection, or when there is a cancer which causes destruction of the bones, or when there is an inflammatory arthritis, when the body produces chemicals which causes destruction of multiple joints in the body. தமிழ்ல முடக்குவாதம், rheumatoid arthritis, அந்த மாதிரி related conditions இருக்கிற patients வந்து கண்டிப்பா வந்து spine surgeon பார்க்கணும். But majority of the commonest cause of the pain வந்து பார்த்தீங்கன்னா degenerative or wear and tear changes, for which வந்து நம்ம by taking care of spine by ourselves, by following certain precautions, certain exercises, certain posture, அது ஃபாலோ பண்ணுறப்ப வந்து நமக்கு வந்து in majority of the patients they say they have seen improvement in their symptoms. So today in this talk we will be discussing more of the degenerative or wear and tear changes that is happening in the spine that could lead to symptoms like pain or discomfort. So there are factors which are not in our control. For example, when the age, as one ages, the degeneration and wear and tear changes do happen. It will happen in all. It will happen in you, it will happen in me. It's just like graying of the hair. But in some patients who are not taking care of their spine properly, it can happen at a faster rate. And it can also be mediated by genes. For example, வந்து அவங்க அப்பா அம்மாவுக்கு வந்து இந்த தேய்மானம், ஸ்பைனில் வரக்கூடிய தேய்மானம் இருந்தது அப்படின்னா உங்களுக்கும் வரக்கூடிய வாய்ப்பு வந்து அதிகம். அட் அன் யங்கர் ஏஜில் வரக்கூடிய வாய்ப்பு வந்து அதிகம். ஸோ போத் ஏஜ் அண்ட் ஜீன்ஸ் வந்து are not in our control. So let's focus on factors which are in our control. Like நம்ம என்ன சில இதில் நம்ம control பண்றப்ப we can slow down the wear and tear changes, we can slow down the degeneration happening in our spine. So what are they like? Maintaining an adequate posture, maintaining a proper body weight, avoiding habits like smoking, having an active lifestyle, and following certain precautions in our day-to-day activities. So let's first talk about the posture. So I know like many of you are professionals, you will be working from home job, or even you can be sitting as a cashier, and you can be doing your own business. So I will show you some pictures. முதல்ல நம்ம சில pictures பார்க்கலாம். இதில் ஏதாவது ஒரு போஸ்டரை நீங்கள் வந்து அன்றாடம் இல்லை டெய்லியும் வந்து நீங்கள் ஃபாலோ பண்ணுற நபரான்னு வந்து நீங்களே ஃபஸ்ட்டு ஒரு செல்ஃப் அனலைஸ் பண்ணிக்கோங்க. So if you are one of those people who follow this kind of posture on a day-to-day basis, then you are more likely to develop spine-related complaints. These are all like bad postures. This posture is not entirely good for your spine, especially if you do it on day-to-day basis without paying attention. ஏன்னா நம்ம ஃபஸ்ட்டு முன்னாடியே பார்த்தோம், நம்மளோட ஸ்பைன் வந்து ஒரு ஸ்ட்ரெயிட் ஸ்ட்ரக்சர் இல்லை, அதில் வந்து கர்வேச்சர்ஸ் இருக்குது, இட் ஹஸ் காட் மசில்ஸ் which are supporting our spine. There are lots of muscles which are supporting our spine, and they function in an intricate balance. And for example, ஒரு நபர் இந்த மாதிரி வந்து ஒரு மணிக்கணக்காக நாள் கணக்காக வந்து இந்த மாதிரி உட்காந்து வேலை செய்கிறப்ப என்ன ஆகும் அப்படின்னா, ஸோ இஸ் ரிவர்சிங் தி நார்மல் கர்வேச்சர் இன் his spine, நம்பர் ஒன். நம்பர் டூ வந்து அந்த மசில்ஸ் வந்து அதோட அது 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 உரிய இடத்துலையோ இட் cannot function in a proper way. And initially when this can, whatever changes that are happening are reversible, but if one is not taking care of or paying attention to it and doing this for longer duration, these changes can become irreversible and it can cause permanent damage to your spine. So the key point is maintaining a proper posture. So what is a proper posture? Your head should be centered over the chest should be centered over the pelvis. So head, chest and pelvis should be in a straight line. உங்களுடைய காது வந்து it should be in line with the shoulders. And most importantly, you should be aware of what you are doing. You should be aware of your posture. நீங்க என்ன பண்ணாலும் சரி, like TV பார்க்கறதாலும் சரி, whether you are working in front of the computer, whether you are sitting and reading in a newspaper, just keep on paying attention where your spine is. Okay? And in due course of time, that would become a habit. So being mindful of one's posture is very important. Now let's go on to professional people, like who needs to be working in front of a desktop. So desktop lokarappa, what is the proper posture? So as I said before, you should try to keep your spine as straight as possible. Head centered over the chest, centered over the pelvis. Okay, உங்களுடைய eye level வந்து it should be at the level of the upper end of the desktop. And உங்களுடைய foot வந்து it should be placed flat on the floor. Your elbow should be closer to the chest, and try to use an ergonomic chair. அதாவது ergonomic chairனா என்னென்ன இருக்கும் அப்படின்னு பார்த்தீங்கன்னா, lumbar support இருக்கும். ஸோ lumbar supportனா நம்மளுடைய அடிமுதுகுக்கு தேவையான கர்வேச்சர் கொடுக்கக்கூடிய support, lumbar support இருக்கும். There will be an arm support. There will be a height adjusting option. So try to get a chair which has got these features. Okay. Let's see another picture, another example for a good posture. So in the number of பார்த்தீங்கன்னா அவரோட கண் வந்து it's at the level of the desktop. And suppose if he needs to read the bottom end of the screen, then he just, instead of bending his neck down, he'll just need to drop his, அவரோட கண்ணை மட்டும் drop பண்ணா மட்டும் போதும். So still maintaining an erect posture. So அவரோட சேர்ல வந்து lumbar support இருக்கு, arm support இருக்கு. There is a height adjusting option. His feet is flat on the floor. So this is an ideal posture for working in front of a desktop. Suppose I'm not using a desktop, I'm using a laptop. Then instead of placing the laptop on the table, bring the laptop to your eye level, so that again you can still maintain a proper spine posture. and try to get a separate keyboard and mouse, so that when the laptop then then it should not be that you are operating with your hands up. So try to avoid that, otherwise it can cause shoulder problems and wrist problems. Suppose உங்ககிட்ட ஒரு ergonomic chair இல்லை அப்படின்னா, then even ஒரு normal chairல வந்து you can place a pillow under your behind your lower back, or ஒரு ஷீட்டை வந்து மடிச்சு கூட நீங்கள் வச்சுக்கலாம், ரோல் அப் பண்ணி கூட வச்சுக்கலாம். So keep your feet flat on the floor, and try to get a book stand so that you don't need to bend your neck in reading. So try to maintain this good posture as far as possible whenever you are working. Nowadays, like in the market level, like there are many like laptop stands are available. You can purchase any one of this, and it's really good. இப்போ உங்களோட ஜாப்ல வந்து நீங்கள் நிறையா ஃபோன் யூஸ் பண்ண வேண்டியதாக இருக்குது அப்படின்னா வந்து இந்த மாதிரி பொசிஷன், லைக் கிராங்க்ட் அப் பொசிஷன் வந்து கண்டிப்பாக வந்து உங்களுடைய கழுத்துக்கு வந்து நல்லது கிடையாது. ஸோ இன்ஸ்டெட் கோ ஃபார் எ இயர்ஃபோன் or a headphone with mic option. And the other thing that is becoming quite noticeable in the recent days is text neck syndrome, which is quite common in the younger generation, even in the adolescent people. So seen in people who spend lots of time in phone and in iPads. Okay, ஸோ உங்களுடைய நீங்கள் கழுத்தை குனிஞ்சிக்கிட்டே வந்து நீங்கள் படிக்கிறப்பையோ ஃபோன் பார்க்குறப்பையோ உங்களுடைய கழுத்து எலும்பில் வந்து ஏற்படக்கூடிய ஸ்ட்ரெஸ் வந்து அதிகமாகுது. அண்ட் ஸோ முடிஞ்ச அளவுக்கு என்ன பண்ணணும், ஸோ கழுத்தை ஸ்ட்ரைட்டாக வச்சுக்கிறதுக்கு என்ன பண்ணணும், bring your phone to the level of your face. And to some extent வந்து this reduces your smartphone usage, because you can't உங்களால் ரொம்ப நேரம் வந்து இந்த மாதிரி யூஸ் பண்ண முடியாது. So it has an advantage, it reduces your screen time hours as well. And quite sadly we see even children or more and more children are going into this posture by looking into the screen for longer duration. So bring your phone to your eye level, and even நீங்கள் ஒரு புக்ஸ் படிக்கிறீங்க, ஏதாவது படிக்கிறீங்க, இன்ஸ்டெட் ஆஃப் கீழே குனிஞ்சு பார்க்குறத விட ஒரு டெஸ்க் மேலே வந்து அந்த புக்கை வந்து ஹைட் உயர்த்தி வச்சுக்கோங்க, ஆர் கோ ஃபார் யர் வந்து புக் ஸ்டாண்ட், இந்த மாதிரி புக் ஸ்டாண்ட் யூஸ் பண்ணிக்கோங்க. ஸோ அகெயின் இட்ஸ் வெரி குட் ஃபார் யுவர் நெக். சின் டக். ஸோ உங்களுடைய நெக் பொசிஷன், ப்ராப்பரான நெக் பொசிஷன் என்னன்னு பார்த்தீங்கன்னா, டக் யுவர் சின் க்ளோசர் டு யுவர் நெக். ஸோ அதாவது வந்து so that your ear is in level with the shoulder. ஸோ இந்த மாதிரி பொசிஷன் வந்து இட்ஸ் நாட் குட் ஃபார் யுவர் ஸ்பைன், குட் ஃபார் யுவர் நெக் எஸ்பெஷலி, பிகாஸ் இட் நம்ம கழுத்தில் இருக்கக்கூடிய கர்வேச்சரை வந்து அது வந்து ரிவர்ஸ் பண்ணக்கூடிய பொசிஷர் இது. Okay, now let's focus on like driving. You younger people are like more more interested in driving. So உங்களோட driving posture வந்து again keep your spine straight as much as possible. Get a bike that is comfortable to your height, and don't get influenced by these like fancy bikes. In the mari fancy bikes வந்து like especially for Indian roads, Indian traffic, if you are in this like racing position in your racer bike for hours together, it's not going to be good for your lower back. And this position is good for short term. நீங்க ஒரு ரேசிங் போறீங்க, ஒரு ஷார்ட் டேர்ம் ரேசிங் போறீங்கன்னா that's fine, பட் நம்மளோட ரோட்ஸ்க்கு வந்து I think it's not appropriate. And definitely this position is not good for your neck at all. Imagine வந்து நம்மளோட ஒரு ஹெல்மெட்டோட வெயிட் ப்ளஸ் நீங்கள் வந்து நெக் இந்த மாதிரி வச்சுக்கிட்டு ஒரு நீங்கள் ஸ்பீட் பிரேக்கரில் போய் பிரேக் போடுறீங்க. ஜஸ்ட் இமேஜின் த அமௌண்ட் ஆஃப் ஸ்ட்ரெஸ் that is happening in your neck, and that will most likely will give rise to neck problems in the future. What about car? Again, so try to sit straight. Don't slouch forward, or don't sit too back while driving the car. And again, try to keep your chin tucked so that your ear is in line with the shoulders. And try to get a good neck support and a lumbar support while driving. So what about sleep? So many of my patients, when they have said, as a காலையில் தூங்கி எந்திரிச்ச உடனே I feel stiff, ஆர் வந்து வலி இருக்குது அப்படின்னு சொல்கிறாங்க. கொஞ்சம் தூரம் நடந்ததுக்கப்புறம் சரியாயிடுது. ஸோ it's a possible, a possible cause could be that your sleeping posture may not be right. For example, these are the postures that you should avoid, like sleeping on your stomach is definitely not good for your neck, because you are twisting your cervical spine and then sleeping. So in the long run, it will definitely affect your neck, and it's also not good for your lower back. So what is the proper sleeping posture அப்படின்னு பார்த்தீங்கன்னா, in your proper sleeping posture is where your spine or a natural alignment is maintained. So for example, if you are sleeping on the side, நீங்கள் ஒரு side sleeper இருக்கீங்க அப்படின்னா, make sure that you get a pillow in between your knees. You can also get a lumbar pillow உங்க lower back கீழே வச்சுக்கலாம், and also have a adequate sized pillow for your head. If you are a supine sleeper, நீங்கள் நேரா படுக்கிறவரா இருந்தது அப்படின்னா, again, so get a pillow under your knees and get a lumbar pillow under your lower back, and adequate sized pillow for your neck, so that உங்களுடைய spine ஓட natural alignment is maintained throughout your sleep. Okay, so that's about the posture. Now let's focus on the body weight. So which most of us struggle, including me. Maintaining a adequate ideal body weight is quite important for your spine health. The more obese you are, the more stress you're going to place on your lower back joints. So என்கிட்ட வந்து நிறைய பேஷண்ட்ஸ் வந்து like even after reducing like say 5 kilo 6 kilogram weight, they said their symptoms have improved much better. So even shedding a few kilos of weight, you will see the improvement in your symptoms. And smoking again quite common in the younger people. We all know smoking has many ill effects. அது வந்து நமக்கு கேன்சர் தரும், இட்ஸ் நாட் குட் ஃபார் ஹார்ட். பட் ஸ்மோக்கிங் இஸ் ஆல்சோ நாட் குட் ஃபார் யுவர் ஸ்பைன், பிகாஸ் smoking வந்து it reduces the nutrition going to our discs, and it accelerates the chances of degeneration, தேய்மானம் வர்றதுக்கான possibility வந்து increase பண்ணுது. So try to avoid smoking as much as you can. I mean, and the other thing is sitting disease. Now again, very அதிகமாக வந்து recognized ஆயிட்டு இருக்கக்கூடிய condition. We are all spending too much time sitting for hours together. Like நம்ம ஆஃபீஸில் like 6 to 8 hours spend பண்ணுறோம். Then we are driving again, like it takes 1 to 2 hours of driving every day. So this is called a sitting disease, and it can be as harmful as smoking. So they say like sitting is the new smoking. So not only it causes obesity, it affects your heart, it increases the chances of diabetes, cancer, and it also increases your chances of getting spinal complaints. So try to avoid, try to have an active lifestyle. So in case, for example, like if you are a professional who need to work for 6 to 8 hours in your job continuously in front of a computer, so you look for certain alternatives. For example, like sitting and standing height adjustable desks, so where you can work both sitting as well as standing. You can spend some hours in sitting, you can spend some hours in standing. So thereby when you are exercising your spine muscles, you are allowing the nutrition to go to your spine, and thereby you are keeping your spine healthy. So yes, of course, yes, இதெல்லாம் வந்து you need to invest from your pocket. Your boss may not be willing to do that, but if you're investing in this kind of small things, then definitely you will be able to enjoy the returns later. So the key is avoid being in one posture for too long. So at least every 30 to 45 minutes you should stand up and walk for at least 1 or 2 minutes, do some stretches, thereby when you are exercising your spine muscles and keeping your spine healthy. And in fact, sometimes when they can even use a timer, like every 30 minutes when they can use a timer with your watch or in your phone that reminds you to get up and do some stretches or walking. Now let's move on to exercise. These are it's important that you do some focused exercises for your spine, and these are very simple exercises. It doesn't take too much time. You just need like 15 to 20 minutes in a day. Some of these exercises they can be done even sitting in a chair while working. And it's important that you strengthen the muscles which are supporting நம்ம பார்த்தோம், which are muscles supporting the spine. So இந்த muscles strengthen பண்ணக்கூடிய exercises நம்ம பண்றது ரொம்ப அவசியம், especially the core muscles which are supporting our lower back, the abdominal muscles. You don't need to have a six pack, but you need to have an adequate tone and adequate strength to support our lower back. Suppose if you உங்களுக்கு இந்த மாதிரி exercise பண்றது like if you feel it is boring or monotonous இருக்கு அப்படின்னா, you can go, there are other options like yogas, tai chi, even working in the pool like hydrotherapy, which is not yet very popular in India, but abroad they have hydrotherapy sessions where people work out at the swimming pool. So they're all very good for your spine and spinal complaints, and swimming is a very good exercise for your spine. So now coming to standard precautions, precautions that we should avoid or we should follow during our day-to-day activities. Like for example, for lifting weight or weight and a box what is the correct posture? So instead of bending your back, bend your hips and knees and then lift the weight. So that is the correct lifting technique for lifting weight. And try to keep the weight as close as to your body, so that when it reduces the stress that is happening on your spine. Similarly, we might have like young mothers in the session. So while lifting your baby, bend your hips and bend your knees and then lift the baby, rather than arching over and lifting your child. So when to consult doctors? So if the pain persists or continues for more than 6 to 10 weeks together, or if you have any nerve pain, for example, if the pain radiates or spreads from neck down to your fingers or back down to your legs, or if you have any fever like loss of weight, பசி எடுக்கல, or if you have other joint involvement, then it is important that you consult a spine surgeon or a spine specialist for further evaluation. So what are the some of the frequently asked questions like சார் நான் என்ன பில்லோ யூஸ் பண்ணலாம், இல்லை பில்லோ யூஸ் பண்ணாமல் வெறும் தரையில் படுக்கலாமா? And the other one is like நம்ம again தரையில் படுக்கலாமா இல்லை ஏதாவது என்ன mattress யூஸ் பண்ணலாம்? So there is no right or wrong answer for that. Whatever you feel comfortable, you can use it. So நீங்கள் தரையில் தான் படுக்கணும், அதுதான் நல்லது உங்கள் ஸ்பைனுக்கு அப்படின்னு எதுவுமே கிடையாது. Some people they feel comfortable for them. So yes, they can. So it's a trial and error method. So you might need to try different pillows. சிலருக்கு சில pillow comfortable இருக்கும். Then you stick onto that pillow. The same is the answer for your mattress or the sleeping on the floor question as well. So no right or wrong answer. You need to try few different options. But you need to follow certain precautions, like your pillow should neither be too high or neither to be too low. Your pillow should support your neck region, and உங்களோட mattress it should not be too soft. நீங்க உட்கார்ந்து அப்படியே ஃபுல்லா அமுங்க கூடாது. There should be some amount of firmness, கொஞ்சம் firm-ஆ இருக்கணும். And what is firm for you may not be the firm for me, because இப்போ ஒரு 100 kilogram person இருக்காங்க அப்படின்னா the mattress may not, what is firm for me may not be firm mattress for him. So it's more subjective, and you need to evaluate by yourself. So there is no right or wrong answer for this. And try to change the mattress like every once in 6 to 7 years more, and that's the lifetime for a proper mattress. So நீங்க அதுக்கு மேல யூஸ் பண்ணிட்டு இருக்கிறது it may not be good. So the key points from this talk will be is maintaining an adequate posture, keep moving. Don't sit or maintain in one posture, be in one posture for longer duration. Stretching and exercise is very important to your spine. Avoid smoking. And follow certain precautions during your day-to-day activities, and consult when your symptoms are continuing or when you have any nerve-related symptoms. Thank you.
Thank you, Karthikeyan sir. It was really a wonderful information to every one of us.
Thank you.
So our resource person will be available for next 3 to 4 minutes. If anyone has any questions to ask, you can unmute yourself and you will be asking. Sorry for the audience who are not able to join. We had more than 100 plus participants today, but Google Meet allows only 100 as the last count, maximum count to be in the meeting. So we couldn't add more people. So we could find any alternatives in future. Is possible?
I have tried to record the entire presentation, so I will forward it to you. Maybe you can share it, yeah, with your members. Yeah.
Sure. So we have one question in our chat box. So the question is how we can strengthen our spine through food consumption? Is there any possibility for it through food habits?
There is nothing like இந்த சாப்பாடு சாப்பிடுங்க உங்கள் ஸ்பைனோட ப்ராப்ளம் எல்லாம் தீந்துரும் அப்படின்னு வந்து there is no food like that, but maintaining a healthy diet, calcium rich food, uh, uh, I can say it's good for your spine, it's good for all of your bones, okay. பட் ஸ்பெசிஃபிக்காக வந்து இந்த ஃபுட் சாப்பிடுங்க உங்களோட ஸ்பைன் ப்ராப்ளம்ஸ்லாம் தீந்துருங்கிற மாதிரி எந்த ஃபுட் எதுவும் கிடையாது. ஜஸ்ட் அ ஹெல்த்தி டயட் and a healthy exercise and healthy lifestyle that is adequate for your spine.
One more question, so for marathon runners, give tips for spine protection.
So marathon runner, one important protection is like getting your shoes right. So that's the most important thing. I have not come across many marathon runners presenting to me with spinal complaints. But if your shoes are not good, then yes, it can cause low back problems. But other than that, nothing specific for marathon runners. So get your shoes correct.
Yes, we have one more question from Hari Prasad. Yes, Hari Prasad.
Sir, good morning, sir. This is a Rotractor Hari Prasad.
Good morning, Hari.
சார் இப்போ வந்து நைட் ஷிஃப்ட் ஒர்க் பண்ணும்போது என்ன ஆகுதுன்னா சார், ஒரு 8 hours ஒர்க் இருக்குன்னா எங்கள் மேக்ஸிமம் நாங்கள் ட்ரை பண்ணாலும் 2 hours வந்து நாங்கள் ஸ்டிஃபாக உட்காந்து ஒர்க் பண்ணுறோம் சார். பட் அது எங்களுக்கே தெரியாமல் ஒரு லேசினஸ் வந்து எங்களால் ஸ்டிஃபாக உட்காந்து அதை வந்து ஸ்டேபிளாக அவங்களால சஸ்டெயின் பண்ண முடிய மாட்டேங்குது சார். ஸோ இதை வந்து நம்ம எப்படி ரெக்டிஃபை பண்ணுறது, இதை நம்ம வந்து எப்படி ப்ராக்டிஸ் பண்ணுறது சார்? 8 hours நம்ம கண்டினியூஸாக அப்படி இருக்கணும்னா
இல்லை வந்து லைக் இப்போ 2 hours இப்போ நோபடி இஸ் கோயிங் லைக் இப்போ யாரும் வந்து பக்கத்தில் நின்று சூப்பர்வைஸ் பண்ணிக்கிட்டு நீங்கள் அப்படி தான் உட்காரணும்னு ஃபர்ஸ்ட் ஆஃப் ஆல் நோபடி இஸ் சூப்பர்வைசிங் யூ, ரைட்? நம்பர் 1. அந்த மாதிரி யாராவது சூப்பர்வைஸ் பண்ணுறாங்களா? இல்லை. நம்பர் 2 வந்து I've come across many like few patients who say the similar things. It's easy thing is like get a timer. இப்போ நீங்கள் லேப்டாப் யூஸ் பண்ணுறீங்கன்னா உங்கள் லேப்டாப்லேயே வந்து there is a timer which blacks out your screen. Like every 20 minutes வந்து என்னோட லேப்டாப் ஸ்க்ரீன் வந்து black out ஆகிடும். It will force me to look away from the screen, look away from the stand up. So I can use that time, like say 20 seconds, when it will not allow me to do any work. ஸோ அந்த மாதிரி நீங்கள் ஆப்ஷன்ஸ் நீங்கள் ட்ரை பண்ணி பார்க்கலாம். But the key is, as I said, do not sit in one posture for more than 45 minutes. ஒரு posture நீங்கள் 45 minutes மேலே இருந்தீங்கன்னா you're more likely to develop stiffness, especially with the stress that you are going on through your work. You will develop more stiffness and you will become symptomatic. Have I answered your question?
Yes sir, yes sir, yes sir.
So get a timer. உங்க timer வந்து நீங்க watchல வச்சுக்கலாம், இல்ல even laptopsல வச்சுக்கலாம். Like there are so many apps they have come now. I use a timer specifically, like every 20 minutes வந்து it will black out, and it's good for your eyes as well. It reduces your eye strain as well. I find it really very useful. நீங்க அந்த மாதிரி நீங்க timers try பண்ணி பாருங்க. I think you will benefit from it.
Oh, thank you sir, thank you for your valuable tips sir.
So we have one more question from Arun Raj. So he wants to know, does cycling affect spine and exercise to strengthen?
Cycling doesn't specifically affect your spine, but if you're cycling in a bent over position, maybe yes, it can cause increased stress in your back. Um, uh, but unless you're a cyclist இருக்கீங்க அப்படின்னா இந்த மாதிரி bent over positionல நீங்க ரொம்ப ரொம்ப நேரம் சைக்கிள் பண்றீங்கன்னா, yes, it can lead to some increased stress on your spine. But otherwise, நம்ம இப்போ video we are going to put some videos like what are the exercises that we do for your neck and back that you can follow on by yourself at home. I think that will be useful. So we will be putting out that video by next week. You follow. I think you should follow those exercises. It will be really good for your spine. But there is nothing specific for cyclist. Unless you are a cyclist or participating in race la போறீங்க அப்படின்னா வந்து try to limit your cycling duration for like 30 to 45 minutes and try to maintain a proper posture, and on top of that you need to do certain exercises for your back. Then that will have, I think that will be useful for your cycling.